for every time I had a woman sit across from me, a brilliant, educated, capable, professional, respectable woman say, how do I not know this about my body? And the only answer is because no one taught you. You were only
Yes.
taught to contraception.
Like
We
they
taught
come and they're like,
contraception
I've
with a
only ever thought about how to not have a baby.
right,
Now
right,
I want to have a baby and I have no idea how to get pregnant,
right,
apparently.
right,
Like, what is happening?
right.
It's like the majority of women are going to start having perimenopausal symptoms in their late 30s and early 40s. And
Mhm.
that's at this point when the majority of women are wanting to get pregnant.
Yeah.
So your cycles are already hit or miss. You're already not really ovulating as much as you used to or think that you are. And
Mhm.
where I feel like providers don't do as much as they should or could in that area, we oftentimes, oh, we're just going to try again. Don't worry, we're just going to try again.
Yeah, they'll say it's a
Barrel
numbers
through,
game.
keep
Yeah.
going. It wasn't a real pregnancy. Oh, it was an early miscarriage. You don't worry, you'll have another baby, whether that's IVF or just regular, right? And we don't do enough validation
Mhm.
on the emotions that women go through in
Mhm.
this process.
Hello and welcome to today's episode of Health University, where we're going to have a really fun conversation today with Abigail Prushansky. Am I pronouncing that name correctly?
You are correct.
Got it. Yay. She is a certified functional medicine nurse practitioner and a certified midwife. And we're going to talk about why you might want to consider using a midwife for your preconception care. But first, let me give you her little bio here. She's a mother and a women's health provider and a champion for the autonomy of her patients. She's cared for hundreds of women in all stages of life, and she knows the challenges of getting pregnant, staying pregnant, dealing with postpartum, and entering the transition into perimenopause and then menopause. She works with people struggling with infertility and miscarriages, which is a big focus in our conversations here at Health University. Urinary incontinence, which is often common postpartum, pelvic floor dysfunction, and then hormonal shifts that we, including vaginal dryness, that we need to attend to sometimes in our perimenopausal, menopausal years. She has a resistance to, and I share her resistance to the phrase, just deal with it in our phases of life because we deserve to not just be told go deal with it, but we deserve compassionate care and understanding and help in navigating through any of these transitions. And so she created Full Circle Premium Health so that women will have a compassionate and empowering place to heal. So welcome, Abigail. First, tell me a little bit about the Full Circle Premium Health. Is it online? Is it in person? Say more about what is Full Circle.
Definitely. First of all, thank you for having
My
me. There's
pleasure.
nothing I love more than to talk. So,
Mhm.
yeah, so I created Full Circle, and it is technically a provider's office. I
Mhm.
do as well do telehealth, but not typically for anyone that hasn't been an established patient.
Mhm. Okay.
Once they're established, there are a lot of visits that we, can really do on a HIPAA compliant telehealth, and I'm more than
Mhm.
happy to do that. But what the reason behind why I created it was, as a woman going through numerous changes myself, right? I've birthed 4 children, I have 3 living children. I
Mhm.
really, when I became a midwife, wanted to focus on just the whole woman. And I felt like a lot of times we focused on wanting to get pregnant. Then we just focused on being pregnant. Then we just focused on, okay, the birth. And then even after the birth, women are kind of like shoved back out into society, left alone with what little support system maybe they have in place
Mhm.
to figure it all out.
Yeah.
Right. And then with perimenopause and menopause, like there was really nothing for women to figure out. They were being told, it's just a normal part of life. Sorry.
Here's a
But
patch. Good luck with that.
yeah,
Hmm.
and so I just really felt there was a need to just be with women, right? And I think that's kind of the real definition of a midwife, right?
Yeah.
It's just to be with women. And even if that is just a lot of hand holding and emotional support, right? Not everything has to be just a medical aspect.
Right.
We're more than just the body and the skin that we wear.
That's for sure. Oh,
And yeah, so that's kind of the reason why I developed this.
okay. That's beautiful. How I think I heard you say that, if someone needs to come in for an initial office visit and you are in California, then I want to make sure
Yes.
the
So that
midwife.
everyone knows,
Mhm.
I am based in California. My office location is currently in Torrance, California, which is still part of Los Angeles County. And yeah, to be fair, I haven't really had a lot of out of state um requests. I do have a lot of people that fly in and see me for the
Mhm.
first visit, and
Mhm.
I can do a lot of follow up regardless of where they live.
Brilliant.
And it really depends, right? I mean, if we're talking a lot about something that involves the physical aspect where I really do need to be hands on,
Mhm.
I can't really do that
Mhm.
over the computer screen. But a lot of things start hands on, and then really, we can do a lot through the screen after
Sure.
that.
Sure. Reviewing labs, touching base, making
Yeah.
recommendations, pivoting a little bit on, either dietary lifestyle or supplement recommendations, things like that.
Yes.
Yeah.
I will say for things like just hormonal, like replacement consults,
Mhm.
sometimes I'll do those
Mhm.
virtually, even if they're in another state,
Mhm.
because there isn't necessarily a large physical exam that has to go along with that.
Mhm. Mhm.
I do prefer to do a full physical exam if possible, but a lot of clients, if they've been on something already and are just looking because they no longer fit with the person that they're currently with for
Mhm.
whatever reason, that's doable.
Okay, very good. So, and it's you hit on I think a salient point in that we think of midwives as being someone we call on when we are pregnant and preparing for birthing. We think of them as birthing support systems, if you will.
Yeah.
But to your point, a midwife is really there to support a woman through wherever she is. Do you ever work with, younger women who are maybe even before their preconception?
Yes.
Hmm.
So, the reason that I also became a family nurse practitioner was because oftentimes, yes, midwives are seen in the scope of only when I have a baby. And we do a lot more than that, but I also wanted to offer more and dig deeper than what most nurse midwives will offer in their own practices.
Hmm.
Yes, so to answer your question, I do work with a lot of younger women. Obviously, as soon as a woman or as soon as a girl becomes a woman and gets her first menses, I have been working with another nonprofit and doing a lot of education around the menstrual cycle, which I think is incredibly important. How can
Thank
we
you.
later years in life want to have a baby, but we don't understand how our body works
And
in our younger
if I had
years?
a nickel for every time I had a woman sit across from me, a brilliant, educated, capable, professional, respectable woman say, "How do I not know this about my body?" And the only answer is because no one taught you.
Well,
You were only
yes.
taught to contraception.
Yeah.
When
It's so true.
right,
Like
we're
they
taught
come and they're like,
contraception
I've
with a
only ever thought about how to not have a baby.
right,
Now
right,
I want to have a baby and I
right,
have no idea how to get pregnant,
right,
apparently. Like,
right.
what is happening?
Right. And even with the
And
contraception, we lost touch with our rhythms to know to know when not to have intercourse or unprotected
yeah,
sex. And
yeah,
we relied on the pill for, 30
yes.
days.
And
Hmm.
I'm a firm believer that even though younger women, in my opinion, shouldn't rely on natural family planning
Oh, I
in
agree.
the
I
early,
agree.
late
But
teens, early 20s,
absolutely. But there's
wouldn't be
just a
my preference,
missing.
but
Yes.
to
No,
everyone
no,
their own.
we're on the same page. Hmm.
I do feel like, the average onset of menses is like 11 to 12, right?
Hmm.
That's the average. It doesn't mean you can't get a girl that's 9 or 10 or another one that's around 12, 13, 14. But I feel like we need to really start doing, well women type exams as soon as girls get their menses and not how people associate that with a pap smear, right? We're not doing that on somebody under 21 or if they're not sexually active, right?
Hmm.
But to teach them about their bodies.
Yes.
Because, yes, then when they become mid 20s, late 20s, early 30s, late 30s, even early 40s, because
Yes.
let's face it, last year was the first year the average age of a woman giving birth was in her 40s.
Yes. Yeah.
right? The majority of women were early 40s giving birth.
Mm-hmm.
So, that's relatively 20 plus year gap of not knowing your body
Exactly.
before you
Exactly.
go to have a
Right.
baby.
And I concur. I am fully in support of, conventional contraception. But my argument is that that should not have removed the education piece. It
Yeah.
became a replacement for education, because it used to be that we had to be mindful of that before contraception was so available. And so, yes, I think that bringing education back, that's the whole point of this podcast. That's the whole point of my own courses and programs, is that I really want people to understand what is happening in their bodies. And these people tend to be those who have ovaries and uterus.
Mhm.
It's
And let me
really.
say as well, I feel like a lot of people don't know this,
Mhm.
but insurance covers contraceptive counseling,
Mhm.
right? That's
Mhm.
without having to prescribe anything. So as a
Mhm.
parent, who maybe a parent is listening with a younger, woman who's about to get menses or has just started getting menses, you can come in and have discussions. Contraception doesn't have to be, medication.
Right.
It can really be counseling, simply that, and educating them on their body. And then you're getting an office visit theoretically covered under your insurance,
Brilliant.
and it equips the parents as well. Maybe there's some things they don't know or realize because
Mhm.
they were never taught.
Mhm.
And then it also destigmatizes what a period is for a lot of young girls.
Absolutely.
And I'm a huge fan of doing that
Mhm.
prior to ever putting girls on a form of contraception. Like if I'm
Mhm.
going to prescribe you something, I want to know that you know how your body works, because
Mhm.
that's going to be in conjunction with using this
Right.
to avoid pregnancy if that's what we're using it for.
Yeah, brilliant, brilliant. And I think it also takes a big piece of fear away from your first gyne appointment. When, by age 21, it's going to include an exam, which can sometimes feel intimidating.
Yeah, and that's
Um,
great because
mhm.
at 19 and 20, you can in both those years just pull out a speculum and be like, look, this is what it looks like. It's not as
Mhm.
scary as it seems.
Mhm.
You have one that's just a sample. They can touch it, they can feel it, they can look at it.
Mhm. Mhm.
I do that with a lot of my girls because then, yes, when they come in at 21, if they're sexually active, they are like, I was prepared for this. Okay.
Right, right.
And the same thing about even before they become sexually active, right? Really going through like, what is consent? What does that look like? You can
Mhm.
withdraw it at any moment. That goes by not just sexual encounters, but that goes by us as providers too, right?
Mhm.
If you're starting to feel
Mhm.
uncomfortable or if you're having some pain, like you are the driver's seat, and
Yes,
giving women that power
yes.
to actually have a voice when
Mhm.
often I really hear a lot of stories where they didn't feel like they
Yeah.
did.
Yeah, and it's traumatizing, and it's traumatizing without being acknowledged as trauma, even because it's the way things are, if you will. And so now they've got this stored sexual trauma that I can't even identify as trauma because it wasn't necessarily something as severe as rape or molestation. So
Right.
it's simply an office visit. So this is brilliant. I'm so, so grateful that you're covering the spectrum of womanhood. So let's wiggle back a little bit to preconception care. In your
Yeah.
practice, what do you do for a preconception care visit?
So for a preconception care visit, if it's the very first time I'm seeing them, and that's what I'm seeing them for,
Mhm.
a lot of it is deep diving into history.
Yeah.
If it's an already established patient, we have a bit of that rapport. I know a little bit more about their history. So the visits tend to be a little bit shorter and differently focused.
Mhm.
But if it's someone new, really, I dive into everything from even the smallest of sicknesses that they've had in the last couple of years to
Mhm.
any ailments to any other actual diagnosis. If they have previous blood work, that's great. If not, then obviously we're going to get a whole bunch of blood work.
Mhm.
And going over things from what does your nutrition look like? I mean, if I had a dollar for every time someone thought that they ate healthy,
Because,
I'd be a very wealthy woman right now.
right, because they're having a protein bar and a
Yeah. Well, and the
and a
hardest
fat-free
part
muffin.
is for all of the good that social media has done
Yeah.
by being able to really get this kind of education and stuff out there.
Mhm.
For every one of us who is a professional in this field, you have 300 people not in the field who are influencers
Yeah.
spreading whatever seems to be some hot topic that week. And
Mhm.
sometimes a lot of that information isn't exactly accurate, or it's bits and pieces that have kind of been folded together.
Right.
And so nowadays, a lot of it is like backtracking. I'm like, well, what
Mhm.
actually do you think healthy is? What do you think it means?
Mhm.
And same thing with different types of exercises,
Mhm.
or, that they think their body's in really good shape, but they're, essentially for a pregnancy, they might not be.
Yeah. 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 They might be too lean, for instance, to hold a pregnancy, to get pregnant. I'm sure in Southern California, you might see a little bit more of that than might be occurring perhaps in the Midwest, because, there's a certain look that we're accustomed to
Yeah.
seeing in the Beverly Hills-ish area. So,
True. I mean, I will also say, I feel like PCOS is diagnosed a lot more now that the guidelines
mhm.
have changed a few years ago.
Mhm.
And that can cause a whole bunch of things. I think a lot of women have been undiagnosed for endometriosis, which is a
Mhm.
whole nother problem when you're trying to get pregnant.
Mhm.
And again, that goes back to being put on contraception so early that oftentimes these things possibly would have been diagnosed in their
Without a doubt, in
earlier
my mind.
20s or late
Mhm.
teens.
Mhm.
But because they have these, what they think are real period cycles, but are not actually period cycles, right? They're not ovulating, they're having withdrawal bleeds from a hormone withdrawal.
Right. Right.
That then they want to go have a baby, they get off whatever contraception they're on, and now they're like, well, this isn't normal. Well, no, what we were
Because
doing
it
for
wasn't
all those
normal
years
at
actually wasn't
16,
normal.
right?
It's just
Exactly.
that's what you thought was your normal because you never
Yeah.
learned what your normal was. So a lot
Yeah.
of it too is backtracking
Mhm.
as far back as they can remember,
Yeah. Yeah.
before they went on whatever they went on.
Mhm.
And
Mhm.
a lot of people really don't remember those first few years of
Yes.
their periods. I
Yeah.
have a lot of women that don't even remember the exact age they were when they
Right.
started,
Oh,
I
without a
guess.
doubt. I guess around 13,
Yeah.
14. That's everyone's answer. Around 13, 14.
Yeah.
So, yeah.
Yeah. So a lot of it really is, I mean, it's a full 1 hour conversation.
Hmm.
There's no physical exam in that appointment unless there
Hmm.
really is something specific that they're complaining about that they want me
Hmm.
to look at that
Hmm.
maybe they think could be interfering with something.
Yeah.
And we go through their nutrition.
Hmm.
Sometimes if they
There's
call,
supplements.
exactly, but
Hmm.
I'll tell them, okay, but let's plan your appointment for 2 to 4 weeks from now. And if
Hmm.
you could keep a journal for me, because you're
Hmm.
going to come in and you're going to guess.
Yeah. Yeah.
And that's,
Oftentimes I'll say, okay, if yesterday were a good sample day, let's just go through yesterday and we can extrapolate from there.
but
Hmm.
even in that, I find that people not not to be bad,
Hmm.
but they tweak,
Hmm.
right? Because they don't want to look back to you. They
Right.
don't want to feel like they're being judged.
Yeah.
And so they kind of like people do on their photos these days, they
Mhm. The
semi-filter it
filter.
just a little so they look better.
Uh-huh.
And so I tell them, the more honest they can be with themselves and with me, the better results we're going to have through all
Right.
of this. And so if they could journal for 2 weeks or 4 weeks, and I want them to write down what they eat for their meals, what they eat for a snack, what time that was, what they did for exercise that day, and then bring in, most people use a good period app these days,
Mhm.
I feel
Yes.
like. So I'm like, bring in, 6 months worth of your last cycle so we can
Mhm.
go over that. Are they the same? Are they not? That doesn't count if they've just come off birth control
Right.
because that kind of doesn't really matter. But if they've been off of it, let's say they have been trying for 6 months and they're like, I'm not having any luck. I like to really get a good 6 month snapshot of what your cycles looked like,
Mhm.
and even break out the old school stuff and go over like, this is the first half of your cycle. This is
Yes.
what ovulation is and means. Here's the second half of your cycle. The second half is just as important as the first, and the length
Absolutely.
of it matters. And
Mhm. Yep.
so I
There's a
really
reason we take
reteach
some labs
a
on cycle
menstrual
day 2 and
class.
3, and there's a reason we take some labs on cycle day 21, and here's the reason. And they kind of go, oh, again, wow, I didn't know that. So yes,
Yeah.
education
And
is.
then I tell them to bring their partners
Mhm.
because it takes two halves to create a baby.
Mhm.
And so I kind of need to know as well. And
Mhm.
if the partner is willing to keep a journal for the 2 weeks
Mhm.
or 4 weeks as well,
Mhm.
that's great because then I can see what does the life of the partner look like.
Mhm.
Um,
Are
and
you
I like,
doing semen analysis, sperm analysis?
yes, I will do that. If only really if they've been trying for a while and they
Mhm.
haven't had it done with someone in IVF
Mhm.
and they're
Mhm.
curious.
Mhm. Yeah, well,
Um,
certainly if they've done IVF, then you've got your data there. Because
yeah, and then I really go over sex.
hmm hmm
You'd be surprised how many times I've been like, okay, now tell me in this 30 days, like how much sex have you had? Like when,
hmm
how, where, like and I go and I've had clients who are like, yeah, well, here. And I'm like, okay,
too late.
that's one time.
Hmm
Like our chances of getting pregnant with having sex one time in
hmm
30 days is doesn't mean it can't happen because it does,
hmm
but it makes things harder if we're a little on the older side or a little on the unhealthier side.
Yeah.
So I go through that. And then with them, we devise a plan, right? Are we looking to get pregnant in the next 6 months? Are we looking to get pregnant in the next 12 months? Are we just doing this because it's on the forefront of our minds and we want to make
Mhm.
some lifestyle changes before we're considering coming off contraception and then trying to get pregnant?
You
So I
actually have
really,
people at that
I
phase.
do, I do.
I have never had anybody. I guess it's because I work with a lot of people through their IVF cycles and prepping
Yes.
for their IVF cycles. So I kind of and my the patient population tends to be a little bit older and has had some difficulty. So
Yeah.
their freedom of time is really constrained. And so
Yeah.
I wish I had, and I would listen if I may interject a little bit to the listening audience and viewing audience. If you're listening to this, share it with someone who's not yet trying to conceive so that they can begin to get their data earlier, like
Yeah.
start at around age 28. If and even if you're single and you have no desire to have a child, get an assessment of your reproductive wellness before you don't know what 2 years down
Yeah.
the road is going to bring. So I really wish we had a
Exactly.
standard of care that much
I
like
wish it was
21.
too. I mean,
Much
because
like
it's
21.
so helpful.
Yeah.
And what women don't realize is like the majority of women are going to start having perimenopausal symptoms in their late 30s and early 40s. And
Mhm.
that's at this point when the majority of women are wanting to get pregnant.
Yeah.
So your cycles are already hit or miss. You're already not really ovulating as much as you used to or think that you are. And
Mhm.
so there's a whole nother,
Yeah.
bag of tricks, so to speak, for
Yeah.
that
Yeah.
particular population.
Mhm.
And yeah, I mean, even if you start doing things in your early 30s to mid 30s, knowing that you won't have a baby probably till late 30s or early 40s,
Mhm.
it can really make or break it for a lot of
Absolutely. And if I ruled the world, which I do in my own mind,
women.
I
Yeah.
would be asking that woman if she thinks she wants to have children to consider preparing to freeze her eggs so that she's just
Oh
got
yeah.
some, and I don't like to use the word insurance policy because it really isn't that, but it increases her chance when life reveals itself to say, okay, now it's time. Should something be an impediment at that time, you've got a backup. You've got something to go to. So I am such an advocate for egg freezing.
I
Um,
go even further than that though,
mhm. What's that?
because a, a lot of times, the eggs versus embryos are not as hardy. And so in the thawing process, sometimes like people can think, look, I'm great. I've got all these eggs. And then when push comes to shove and they go to create embryos and then then half of them don't grow or the other half have genetic, like a whole other things can happen is I tell them if they're not with anyone, they
Right.
have no partner currently. And if budget allows, I tell them if you're able to store half eggs, half embryos, but use donor sperm,
hmm
you have
hmm
a better insurance policy.
hmm
Yes, maybe you meet that partner that you want to have children with, you use your eggs
hmm
at that point if you're a heterosexual couple and then you want to use his sperm to create it. But even in the event, let's say that the eggs and the sperm for whatever reason aren't meshing and then you've gone through them all and you're 41 and you're not getting any more eggs, well
hmm
then you can have another conversation that you've got a handful of donor embryos
hmm
and
hmm
see how your partner feels about that. Or
hmm
maybe you don't. You hit 38 and you're like, dear Lord, do I really want to sit around waiting
hmm
on a partner? well, now I have two
Yeah.
options,
Yeah.
right? And but yes, if budget doesn't allow, egg freezing is a lot cheaper.
Yes, it's a lot cheaper. And to the defense of the IVF community, they have really improved the science behind egg freezing and thawing, such that whereas it used to be, 15 years ago, the thawing process was very tricky, and it was always the recommendation to freeze embryos if you could. It's so very improved that I
I
think,
think age too, right?
oh,
Right. So
without a
like if
doubt,
the
of
woman's
course,
already over 35
of
and
course. Hmm.
it's just tricky. I mean, I've had women in their late 30s who have amazing quality eggs and they
Hmm.
do fantastic. And then I've had
Hmm.
women over 35 who get 0 to 1.
Oh yeah.
Quality ends up not being good. They can't even make so
Yeah.
it's
Yeah.
this is why it's so important to start when you're younger,
Definitely. That's
right? Make
right.
sure that I am in good health
Hmm.
to a degree. And that doesn't mean like you have to be some crazy strict person who never has a bite of sugar in your life or,
Right.
has to exercise 7 days a week. I mean, we're not talking about extremes. We're just talking about potentially small lifestyle modifications to
Exactly.
put your best foot forward
Right.
when
Right.
you feel the time is right to make a family.
And some of these changes, these lifestyle changes, like removing plastics, removing some of the cosmetics that are just filled with plastics or phthalates or parabens and so forth, shampoo, toothpaste, all of those things, that's going to make a difference for your current egg quality and
Yes.
for your future uterine health and for the baby because those microplastics we now know are living in the follicular fluid and
But
those
it's living in your
pesticides.
bloodstream too. I mean,
Exactly.
it's
Those
crazy
pesticides are
to
going
think.
straight through at 4 times the quantity into your placenta. So making those cleanup
Yeah.
actions now is really, a lovely way to prepare for the child you may want to have, or your
And
healthy
I think
life, or your
there's
perimenopause. Please connect with us for a fertility assessment call at the link below. We'd love to learn a bit about you and share our resources. And make sure you subscribe to our YouTube channel so that you never miss an episode.
I think there's also this misconception that like what your egg quality is what your egg quality is, and that quality is based on your age.
Mhm.
And while there may be some degree of truth in regard to age, we
Mhm.
can improve our egg quality. We can never improve our quantity,
Mhm.
right? We
Yep.
are born with a set number of eggs. At some point, there are no more.
Yep. Yep.
Not like men, we don't continually reproduce and
Mhm.
continually like
Mhm.
have a child technically till the day we die. But you can improve the quality, which improves your chances.
Yes, I have to pin this a little bit and highlight it because I've had many a debate with reproductive endocrinologists and researchers and so forth in that there is no data, there is no research that anything improves egg quality. And I argue, however, it just lends itself to reason. If we can improve the tissue and the cells of any part of our body, why would it be exclusive to
Mhm.
our follicles in the egg potential growing therein? So
I
little,
agree.
little brackets around that, then nobody can claim, including your IVF doc, to improve egg quality. They're going to take them out in the health that they are,
Yep.
either freeze them or make embryos in the health that the egg and the sperm is, put them into your uterus in the health that it is. So the onus is upon you, viewer, listener, to make that the best environment because
Right. And I
these
can
are
tell
game
you, I've
changers.
seen women who go through a few rounds of IVF who they declare they're okay quality,
Mhm.
who really make very good lifestyle modifications, take a break from it, do a bunch of things, and then go back.
Mhm.
And they're like, oh, they said that my egg quality was good
Yeah,
or really good
yeah,
this
yeah.
time.
No, I get
But
it.
it's anecdotal.
Exactly.
Okay, everybody. Not claiming to be truly backed by evidence-based science, but
Exactly. There are no double-blind
but
placebo-controlled
when you
studies
have people who really are like,
that
oh, I
make
was told I
sense.
started like this, and
Yeah,
it's the same thing like you're saying. If I go to the gym every day, 7 days a week for 365 days, the quality of my muscles will be better.
exactly. Exactly. Yep. 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 So if you're putting in high quality nutrition, high quality supplementation. You're making the lifestyle choices that are going to improve your whole health. They will improve your fertile health. If I may, I wanted to sort of highlight an aspect of my program, the Your Fertile Health program at Health University, to say there are protocols within that program that have been demonstrated in research of over 3,000 women to improve the frozen embryo transfer outcome for women over 35, which then is probably more the diminished ovarian reserve and likely lower egg quality, by 42%.
That's great.
Live birth, 42%. So again, this is just to validate that no, they're not saying we've improved egg quality, but who cares? You've got a live baby, a live
Yeah.
healthy baby. That's the whole point of it. We don't have
Yeah.
to, that we can't necessarily look at the egg itself and say we've improved the quality, but we've improved the outcomes.
Yes. I think
Yes.
as well, a component that really gets lost is the psychological and the emotional aspect of all of this, right? Because it is called a journey for a reason.
Mhm.
And, our internal, our psychological, it really affects us, right? It affects your physical. And, we can't forget that, a lot of women who are starting these journeys are going to potentially have difficulties through these journeys.
Mhm.
They're being pumped full of medications if they're going through IVF. Maybe they've had some what they call the failed
Yes.
cycles.
Mhm.
Maybe they've had chemicals, maybe they've had miscarriages. I did my doctoral project specifically on reproductive grief, which
Mhm.
encompasses a lot of the subfertility, infertility, all the things that we
Absolutely.
don't think of that would be grouped in that. And one of the most fascinating things is that 13.5% every year of women in the United States are going to have some form of reproductive issue.
Absolutely. It is a 1 in 5 in
Mhm.
according to the ASRM, 1 in 5. So it's 20%. And then half the time it's men. So this is not just a woman's or a
Exactly.
female's or a person with ovaries conversation. It really is everybody who's going to be involved in this baby making. So, you make a really good point, because I remember Alice Domar's study that years and years ago, maybe even a decade ago, that spoke to the stress of infertility is equivalent to the stress of a life-threatening health
Yeah.
condition. And so we don't want to just power through, pull up our big girl panties, whatever it is. We really want to give ourselves the time and the support that we need for our mental health and our spiritual health as well, our emotional health, because
Right.
that's going to affect your relationship. It's going to affect your work relationship. It's going to affect your relationship with your body. You will
Yep.
not have as many stress hormone, cortisol hormone interruptions, especially if you're in the PCOS category. So yes, we absolutely want to be recommending, professional therapeutic
Yeah.
support.
Yeah, I mean, and I agree with you. And I think a lot of that is, and I respect all of my colleagues out there, but there's an element to it where I feel like providers don't do as much as they should or could in that area. We oftentimes, oh, we're just going to try again. Don't worry, we're just going to try again.
Yeah, they'll say it's
Just
a
barrel
numbers
through,
game.
keep
Yeah.
going.
Mm-mm.
It wasn't a real pregnancy. Oh, it was an early miscarriage. You don't worry, you'll have another baby, whether that's IVF or just regular, right? And we don't do enough validation
Hmm.
on the emotions that women go through in
Hmm.
this process.
Absolutely.
And I
And
find
their
it makes a
partners. Yeah.
huge,
Yeah.
it really helps. It softens a little bit of that journey for them. A
Hmm.
lot of it can be in the preconception counseling
Yep.
if they have come in with months of trying with no success or having a couple of miscarriages on the way
Hmm.
in the past. And also, all of that plays into their current pregnancy,
Yes.
right? Like, so let's say, woohoo, yes, finally we're pregnant and we're doing all this now, this pregnancy journey. If they've had any form of reproductive loss in the past, that plays into a lot of the current
Absolutely.
and the fears or the PTSD and and so I just think overall, I mean, in all areas of women health, we need to do better. But I think it's really important for providers not to forget that
Yeah.
she is a human, she is
Yeah.
a person,
Yeah.
and
Yeah.
she has feelings.
I'm so grateful that my body of medicine, Chinese medicine, is a whole systems in that part of our inquiry each time includes what we call the five elements, the five emotions, because we want to make sure that we're helping raise awareness of them. If there is an emotional imbalance that's taking place, sometimes they're not even like aware because they're just
Yeah.
dealing with it. They're having their road rage or they're having their depression or they're having their weeping, but they're not even really raising their own awareness of it, let alone finding ways to d sort of disseminate that some of that energy, disperse some of that energy.
Right. And I feel like a lot of women almost have this internal shame
Oh, without a doubt.
around the infertility,
Absolutely.
right? And, it's trying to kind of break through that a little bit and maybe help them find some other women in the area that are also going through something similar
Mhm.
or opening up to their friends. Because oftentimes, right, we're talking about 1 in 4 women,
Right,
probably someone else has had some
right,
some type of difficulty or
right.
some type of reproductive loss. And sometimes just feeling like you're just not in it alone can make a
Yes.
huge
Well, I
difference.
think I get a little leery of the go enter a group because there is sometimes that element of, the lowest common denominator. The most depressed person will get the most, excuse me, airtime, and
Yeah.
then everybody's leaving the meeting feeling low. So if you're going to go into something like that, please use a licensed, credentialed practitioner. Resolve is a really great organization that has those. So you can look at resolve.org and see if there's something like that in your area. But again, just be mindful that you don't want to just go online, find an IVF support group because you may get well-intended support in air quotes, but you may be getting the exact wrong message for what you need. So,
Right, right. And just always remember, like I tell everyone when they're pregnant and about to go into labor, you don't always want to hear the negative stories. So, never be afraid to say, oh, I appreciate you sharing.
mhm,
That was your journey. My
exactly.
journey's different.
Mhm,
And soak in as much of the positive stories as you
mhm.
can, right? Like there's been a lot of research done on like negative energy, positive energy, and how that plays
Yeah.
into outcomes. And so soak up as much, what we call the baby juju or whatever,
Mhm.
because that will uplift you. And maybe it takes you longer than it takes somebody else, or it takes
Mhm.
more effort or more mindfulness around what you're doing, but ultimately we want the good positive energy when we're going through a really difficult experience.
Yes, and it is a challenging experience to be sure, but it's worth every moment of discomfort. And I know that discomfort is probably putting it mildly. In fact, I know it's putting it mildly, but it's so worth it. And so yes, and being in positive energy makes it less uncomfortable. When we're in bad energy or feeling bad, we are constricting, including constricting in the birthing, experience. If it's like I don't want this pain, then it's going to be painful because you're constricting around it. So
Yeah.
yeah.
And the nice part is with doing preconception counseling, and you kind of can go through a lot when and if the clients need further fertility assistance.
Mhm.
That doesn't mean they're dropped or handed off or, because I tell them as well, don't forget that after you become pregnant, you graduate from them back to us.
Yes, exactly.
So this is a relationship,
Hmm.
you know, and we can work very closely with a lot of reproductive specialists
Absolutely.
so
Likewise.
that when they get pregnant and they do come back to us, there has been no feel of this break of care,
Right.
and then, like me as a provider, then I know everything that you've had to go through and endure. And it
Mhm.
just makes my ability to care for you during your pregnancy and your labor, birth, and postpartum period even better because
Yeah.
I can understand the whole picture and the whole story.
Right, right. We're there to sympathize, and you don't have to, relive it and report it and all of that once again. So my takeaways from this conversation are a few, and you can amplify or add on any more that you see. there is a true advantage to having in your support team someone outside of the conventional model who can take the time, because a lot of this is, we live in a time-space continuum. So a lot of this is about how much time can your provider give you for helping you through this journey. So find someone who's credentialed, who's vetted, and who can take the time to help you through this journey. Then, to the best of your ability, kind of make the changes that are going to make the difference.
Mhm.
And then when you're pregnant, don't leave all of this behind. I see people in my private practice weekly in the first trimester because so much happens in that first trimester, and then just once a month in the second and third, and then weekly again 36 to 40, so that they're prepared for the birthing experience. So is there anything else that you would be adding?
Oh my gosh, yes. I will just caveat that I love when they have other specialists on board, right? Because we all offer something just ever so slightly different.
Mm-hmm.
But when it's like a symphony, right? It's different when you just have the strings versus when you have everything outlined, right? The sound you could like, it's just this amazing, beautiful experience.
Mm-hmm.
And what I tell people too is there are other insurance codes that you can see. So let's say your provider can't necessarily give you a full hour. I give my clients an hour, even if
Mm-hmm.
I'm using their insurance, just because I do. Um, that they can use to break it up, right? So like,
Mm-hmm.
okay, like your provider can give you 30-minute appointments. So
Mm-hmm.
you do this, they're going to use this ICD-10 code here. Then you're going to go see the acupuncturist for these 3, 4, 5 times. And you're going to come back and do this other 30-minute appointment here.
Mm-hmm.
Let's see,
Yeah.
there are plenty of ways that we can do this, whether
Mm-hmm.
it's with insurance or not, if you're someone that's a cash pay patient,
Right.
to get you the best results
Yeah.
possible.
Yeah.
And I even love when clients ask to do a Zoom session with their whole team,
Yeah. Beautiful.
right? Because then I'm like, oh, actually,
Like
that's a great point. Like, what
there
would you
are
think?
there
Dr.
are I
Susan,
will
what do
agree.
you think? Like, then everyone's working together and the patient feels involved,
Do you
right?
actually get the reproductive endocrinologist on Zoom as well?
Sometimes,
That's fantastic.
yeah, sometimes I do.
And I
I mean,
mean
I
no
beg
discredit.
them.
I so
I beg
I,
them. I'm like, no, you have to come. Please come. You want me to
uh-huh.
keep referring people to you? You come.
Uh-huh. Okay.
They're not long, but it's
Yeah.
usually if there's like one specific thing and I
Mhm.
feel that things are disjointed,
Uh-huh.
right? Like they're like, well, but this doctor's telling me this, and then this doctor's telling me this, and now you're kind of telling me this. I'm like, listen, that we all need to be on a screen
Uh-huh.
because you need a plan
Mm.
that every single person knows what's going on and what's happening, and it's not working this way.
That is so fascinating. I mean, usually my communication is, with the patient and then with the doctor. So we do full circle that way, but I've never brought the entire team on a
Yeah,
Zoom
it
call.
saves everybody time.
Yeah, yeah, yeah.
Certainly saves me a lot of
Yeah,
time.
exactly,
Right.
exactly.
And then it's really, it saves them too, because now the
Mm-hmm.
patient's not calling their office 6 times
Mm-hmm.
and them
Mm-hmm.
telling them the same information 6 times and then
Mm-hmm.
calling me 6 times. It's like, listen, we're going
Mm-hmm.
to come out. We're all going to get on this call for 30 minutes.
Mm-hmm.
We're going to discuss only this and this,
Yeah.
right? To keep it to the 30 minutes for
Uh-huh.
everybody's time. But these seem to be the two biggest things or the two most important questions or factors. And we're going to talk about that. You write down, I tell the client, please write down all the questions that you have
Mm-hmm.
so that we're not doing this call every week,
Right.
because that gets to
Yes.
be too hard.
Yes.
Um, and sometimes it will be like, if they do have a confirmation of pregnancy
Mm-hmm.
before they graduate sometimes, and let's say
Mm-hmm.
they're having a little bleeding or they're having this, having a that, sometimes that's when I'm like, okay, let's get on. I want to know
Okay.
everything that's going on
Okay.
before they graduate to
Yeah.
me, right? Like, because if
Yeah.
you're coming to me, I don't want to just read
Mm-hmm.
300 pages from your
Right, from your chart notes.
clinic,
From
which is like
gotcha.
stacks like this
Yeah.
high. And I'm like, oh Lord,
Uh-huh.
that's a whole
Yeah.
evening. That's a whole episode of Bridgerton right there.
Exactly. That's hilarious.
I
Oh,
try. I try my
yeah.
best. And it
Yeah.
does depend on who they pick.
Mm-hmm.
Some are better than others when it
Yeah.
comes to bedside
Yeah, I
manner.
have my favorite, and I will call it. I will get to know the patient and then make my referral accordingly. Because some people would, I know from my time with them then who they may best resonate with. And I want to pair them up with that. And so I'm so grateful to have such a trusted, referral network up here.
I do that as well.
Yeah.
And oftentimes I'll give them little tidbits of information,
Mhm.
right? So, as a midwife who delivers in the hospital, even though legally I don't have to have a backup physician, I'm an independent provider.
Mhm.
In order to have hospital privileges, I'm required to have one, right? So like at Cedars, there's 3 different physicians. And
Mhm.
so I tell them, meet with all of them,
Mhm.
right? It's
Mhm.
like, don't marry the first person that you date. Date
Mhm.
a couple people first, see who you like the best. And then I tell them, like, this one's a little bit more soft, a little bit more gentle. This one's a little bit more risk adverse,
Mhm. Mhm.
so if you kind of fit with that model, or I might just be like, this one's got for like a IVF, like they have amazing
Mhm.
outcomes,
Mhm. Mhm.
not great bedside manner.
Yeah,
Like what do you care more about?
exactly.
Getting pregnant
Mhm.
and having your feelings hurt? Because somewhere along the way, you
Uh-huh.
probably will. And that's okay.
Uh-huh.
You can vent to me. Like
Yeah,
if that's what you need to
I love
do,
that. I love
vent, cry, get it all out.
Uh-huh.
Your outcome is a good outcome.
Right. Right.
Or another one that the outcomes are still good. They're not as high, but
Mhm.
good,
Mhm.
but they will treat you as the human that you are. They care
Yes.
about your actual experience and journey, right?
Yes.
So
Mhm.
try
Yeah.
to give as
Got it.
much as I can, and then
Got it.
ultimately we are in charge of our care, right? We are in charge of who
Absolutely.
we
I say
pick.
this to patients all the time. You are the boss of all of us, so behave as though, let us work for you. And of course, we're coming to you with our expertise. So please don't override what we know, but it is not a one directional assignment. So,
And I tell them my job as well is to support you.
hmm
You may make decisions that are not what I think
hmm
you should make or what I would make for myself, or but ultimately you're in charge of your care, and I'm going to support that decision that you make
hmm
regardless. Yes, you
hmm
will know my recommendations, you will
hmm
know what the evidence says, but ultimately this is your
Your life.
body.
That's
This is
right. This.
your pregnancy, hopefully your baby. And,
Mhm.
I am on this ride with you to support you in the best way that I can. And you have to tell me how that is.
Yeah. Abigail, this has been so much fun, and really, I think we could keep going
I
on, but
know. This is
I
the
want to be
problem.
mindful of times because I know that we all have very limited time. So viewers and listeners, thank you for taking the time with us and hanging with us for this, I think, fascinating conversation. I hope we didn't take too much of your time, but
No,
all of Abigail's information will be in the show notes, and so you can reach out to her. Now, tell me, so once again, people need to come to see you once in California
I prefer
for
it.
fertility.
I
Mhm.
do
Okay.
prefer it. If
Okay.
you're California based, I do take Aetna PPO, United Healthcare PPO, and Blue Shield PPO
Okay. Excellent.
currently.
Is that on your
Um,
site as well?
That is on my site as
Perfect.
well.
Perfect.
If you're outside and you just want to have a preconception, you want to kind of go over things, you want to know what my ideas might be to be
Mhm.
helpful. Out of state insurance, obviously I don't take, but I have a fee visit schedule, and that I could definitely do
Okay,
on like a
great.
telehealth.
And then you could probably just give a PDF super bill that they could
A
then.
hundred
Yeah,
percent, yeah.
exactly. That's how my practice in my private practice is cash pay, and so I provide the coded super bill so that they can get reimbursed
Yeah,
for insurance purposes.
dealing with insurance is,
I
not
used
for the
to.
faint of heart.
I used to. I just reached a point of
Oh,
can't
I feel you. I already
anymore.
see myself in 5 years, but for now, I'm like, but I'm
Yeah.
trying. They
Yeah,
need
yeah, yeah. Well,
help. I'm
thank you
trying.
on behalf of the listeners who for whom insurance-based providers are a necessity. I thank you. So, and once again, I thank you for your time, viewers, listeners. I thank you for your time. And as we close out every episode of Health University, I say, class dismissed. If you want more episodes like this at Health University, and make sure you subscribe to our YouTube channel. Thanks for watching, and we'll catch you at our next episode of Health University. But for now, class dismissed.